Hello and welcome to this presentation, which is all about the Ofsted and CQC Joint Area Send Inspection process. This is a process that could involve anybody who works with children and young people aged up to 25 years in Leeds. So we hope this presentation will give you some useful background information and describe some of the practical implications for those partners who are involved in the inspection process. So we'll start with some background information. This is a new framework for Ofsted and CQC area inspections of SEND services introduced back in January 2023, so fairly recently. Although SEND inspections initially were introduced back in 2014 as part of the Children and Families Act then, which saw some significant reforms to services for children and young people across the board, including those for children and young people with SEND. Our first and only inspection in Leeds took place under that former framework back in December 2016, so quite some time ago now. The reforms under the Children and Families Act to SEND services, including the new introduction of SEND inspections, was intended to make radical improvements to the SEND system and improve experiences and outcomes for children and young people with SEND and their families significantly. However, in the past decade, we haven't really seen those improvements come to pass. And that was certainly the conclusion of a green paper in 2022, which investigated the SEND system and found that the reforms had not gone far enough, had not realised those aims of improving services, and that families continue to report a system that is difficult to navigate and that consistently doesn't support children and young people to achieve their full potential. This influenced a new National SEND and AP improvement plan, alternative provision being AP, and this included the introduction of a new and more rigorous inspection framework, as we're going to talk about today. Formally, the purpose of inspections is to evaluate how effectively the local area partnership makes arrangements for children and young people with SEND aged 0 to 25, including arrangements for alternative provision, AP. It also aims to provide recommendations for the local area partnership about how we can improve our arrangements and improve outcomes and experiences for children and young people with SEND and their families. So what do we mean when we talk about a local area partnership? It's a very broad scope. It refers to everybody involved in the planning, commissioning, management, delivery and or evaluation of services for children and young people with SEND aged 0 to 25. So that's an enormous number of parties involved in that. It includes schools and education settings right across that 0 to 25 age range, so from early years right through to higher education, and that includes mainstream, alternative and specialist schools and education settings. The scope also includes all the learning, employment, health, social care and information advice and guidance services that are delivered or commissioned and jointly commissioned sometimes with the NHS by Leeds City Council. So all those services that the council provides or commissions. It also includes health services, so that would be those led by NHS England, GPs, but also those commissioned by the local Integrated Care Board or ICB. Again, sometimes that might be joint commissioning in partnership with the local authority, Leeds City Council, and that would include all those NH trusts delivering community-based health services like health visiting, for example, acute services in hospitals and mental health services as well. And then also private, voluntary and independent sector organisations would also be included in that partnership. So, for example, those that provide short breaks, private day nurseries, independent schools. So a huge range there of different organisations are considered part of that local area partnership. And this inspection is all about how we work together as partners to make the best possible arrangements for children and young people with SEND across our area. In terms of the children and young people who are in the scope of inspection, so the children and young people whose records inspectors may be looking at and considering, those are children and young people aged 0 to 25 who live in Leeds, so are within the borders of the Leeds City Council area, and who at the time of inspection or at some point in the 12 months before it are receiving or have received SEN support through their school education setting, and those who have an education, health and care plan, and those who access alternative provision as well. Children and young people from Leeds who access services outside of Leeds are included. So if they're Leeds children and young people, regardless of where they're supported, what services they access in other areas, they are included, and so are the services they are accessing. However, children and young people who are coming to Leeds from outside of Leeds to access services locally are not in scope. A useful lens for looking at the inspection framework is to consider what was newly introduced in 2023 as opposed to what preceded it in the old inspection framework. So I mentioned before that alternative provision has been introduced now in the scope of the inspection and will be subject to scrutiny. So alternative provision, meaning that educational provision which is provided for children and young people who cannot attend their mainstream school. That could be because of medical health needs, or it could be because they have been excluded or at risk of exclusion from education from their mainstream school because of issues around behaviour, for example. We know that children and young people with SEND are greatly overrepresented amongst those in alternative provision, so it makes sense that alternative provision be in the scope of this framework, and I'd say that's broadly been welcomed across the sector. It reflects a greater concern across the framework around children and young people who may face multiple disadvantages. So we know that children looked after, children in need are also overrepresented in terms of those who access alternative provision. We know that children and young people who are living with challenging financial circumstances are overrepresented in alternative provision. So these are children and young people who may face multiple barriers to achieving their full potential and require that additional support to make sure that they can achieve. This is accompanied by the introduction of new lead social care inspectors. So formally, the inspection team that would come and inspect the local area would be led by an education lead and also a health lead, so from Ofsted, from the CQC, respectively. Now they will be joined by a new lead social care inspector who will bring that additional expertise in terms of social care to the table and provide a more rounded, holistic view of the local area's arrangements and services. Another new element of the 2023 framework is a greater focus on the real impact of services on children and young people's lives and their outcomes. The former framework was pretty focused on statutory obligations. Are we, as services, meeting our legal requirements? But now there's a greater focus, while that continues to be obviously very important, there's also greater focus on the actual lived experiences of children and young people with SEND and their parents and carers and families. And accompanying that, inspectors are going to gather more information directly from children and young people and their parents and carers. And we'll talk about how that works in the process in a little while. There are some new inspection judgments as part of the new framework. So formally, there was no judgment, no conclusion of the inspection as such. A local area would be provided with a report that would highlight things that were going well, good practice, good provision, but also areas that need to be improved. And often that would be the end of the matter. Only if an area was considered to be significantly failing would there be much closer scrutiny of them. Now we have 3 new judgments which will provide information about how the local area is performing, what we need to do to get better, and who is accountable for making that happen. It's important to note that while there is a judgment made, that judgment pertains to the local authority, so Leeds City Council, and the Integrated Care Board responsible for commissioning health services. So individual schools, individual settings and organisations, other than that, will not be subject to a particular judgment. And that's because generally they are already inspected under other frameworks. So if you think about schools, for example, they are already inspected and have a judgment made accordingly. Alongside those judgments, at the end of an inspection, within a fairly short time period, every area must produce a new revised multi-agency strategic plan for the area. So in that, the local area partners should consider what the inspectors have found, what their conclusions and judgments are, and should then update their strategy, their local plans for improvement to reflect those recommendations and move forward accordingly. Okay, that's enough background information. Let's look at what actually happens during the inspection. First up, we're going to look at some of the key elements of the process before we then look at how those roll out over the 3-week period of inspection. So some of the key activities that we'll have to support during the inspection, firstly, providing information. So very early on in the process, the local authority, Leeds City Council and Integrated Care Board, we need to provide a range of data, person level data of lists of children and young people in the city with SEND and the characteristics about them, and information about our services, our partnership, how we work together, how we undertake decision making, our systems of governance. This is a long list of information that will be required that's set out in what's called Annex A of the Inspection Handbook, which is online. Essentially just a list of information that's required, quite extensive information. And this includes a detailed self-evaluation, which we call a SEF locally. And this is where we set out our Leeds context, but also talk about our how we feel we're doing as services, as a partnership across the city, what's working well for our children and families, what isn't working so well, and what are we planning to do about it. Another activity is sharing surveys. So inspectors will provide surveys on their online systems and expect us to share those widely. And there will be one for children and young people with SEND, one for their parents and carers, and another for practitioners. So this is a way that all of those people can have a voice in the inspection, can influence the inspection to some degree. The survey responses will only be seen by the inspectors and can be provided anonymously. So we really encourage everybody working with children and young people with SEND, which is pretty much everybody working with children and young people. We really encourage all of you to take part in those surveys and have that opportunity to share your views and voices and have an influence. A key activity and one of the more demanding activities in the process is what inspectors call tracking. This is where they select a sample of children and young people and they will undertake in-depth analysis and audit of those children and young people's experiences of accessing services. It will be a sample of 6 children and young people, and the inspectors will aim to meet with each child or young person, their parents and carers as well, should both parties be happy to do so. And they will also expect to meet and require to meet with a group of the education, health and social care practitioners working most closely with that child or young person, and that will be a group meeting as a small group. And those meetings will generally be virtual, so taking place over online systems, usually MS Teams, possibly Zoom. At least 2 of those children and young people will be accessing SEN support, and at least 1 will be accessing alternative education provision. So we can expect to see that, but it's highly likely that inspectors will also select a child or young person accessing specialist education provision, and potentially they'll be interested in children in specific circumstances. So, for example, they might like to look at the experience of a child or young person who is electively home educated at home. They may want to look at the experiences and support offered to a child looked after in the city. There'll be plenty of meetings during the process, and we'll talk more about those shortly. Inspectors will want to meet with local service leaders and practitioners. They'll want to meet with the local parent carer forum. We have a very active local parent carer forum in Leeds. And with other parent carer groups, there are many dedicated groups across the city that we can offer inspectors the opportunity to meet with, and with groups of children and young people. And again, those meetings will largely be virtual, some potentially in person. And finally, another crucial aspect of the inspection will be visits. So this is where inspectors will visit a sample of schools, settings, frontline services, and they will do that in person. So that could be schools, education settings of all kinds, mainstream, alternative, specialist. It could be frontline health services. It could be early help services. It could be any kind of frontline service, such as a short breaks provider, for example, anywhere that children and young people and families are actively accessing. And they'll want to talk to the leaders and practitioners there about specific children and young people. They might select a child or young person who is registered or enrolled there and want to discuss their experiences, and they'll want to speak very much with those practitioners who know the child best. This isn't going to be about only talking to leaders and managers and head teachers. It's going to be about talking to people who know the child best and see them most often. They'll want to examine and talk through records that are held about the child or young person and their family as well, and have those available to them. As well as those frontline services, inspectors will make some visits to those working behind the scenes, as it were. So how learning, health and social care services, often those in Leeds City Council or in the Integrated Care Board, how are decisions made? How do we provide oversight of services and support for services? They may want to look at certain processes that we're accountable for. So, for example, an assessment and care planning process, like the education, health and care needs assessment and planning process. They may want to explore a specific protocol. For example, the fair access protocol is a good example there. They'll want to look at how we deliver certain aspects of what we're required to do and what we do to support local settings and partners widely across the city. And again, they'll want to speak to the people who know that process well. It won't just be about the leaders and managers who are accountable for things. They'll want to talk to people who deliver aspects of that service on the day-to-day. So what does this look like throughout the process in terms of a 3-week process? What's happening day by day? We will almost always get the notification call for inspection at on a Monday morning before 10 a.m. And that would be considered day one of the inspection process. It's not officially the inspection itself at this point, but it is a key week in terms of what the inspectors would refer to as pre-inspection, and probably one of the busier weeks for us in terms of delivering the process. The only occasion where we wouldn't receive that notification call on a Monday morning would be if the Monday is a bank holiday, and then we could receive the call on the preceding Friday afternoon. And the inspection process starts immediately. There is no other warning. We are straight in on day one. So those of us like myself supporting the process behind the scenes will have a big job to do in terms of communicating that the inspection is happening. So all those different services that we talked about earlier who are involved in the process, getting communications out to them to make them aware that the inspection process has begun. As we mentioned before, providing data and information is a key part of the process, something we have to do early doors. So providing all that information about our services locally, our partnership, how we work together, and our arrangements for doing that. All that information set out in Annex A, and we have to do that. Some of that information by 11 a.m. day two. So that's obviously very early in the process. We have to have that information ready to go beforehand. These surveys will also be made available, and we will be sharing those widely. So the surveys for children, parents and carers, practitioners, will be sending those out widely, and we'll be asking for everybody's support to share them. So if you're a practitioner or a leader in a school, we might be saying, please, would you consider sharing this with your school council, for example? Would you consider sharing this with classes, and sending that out very widely to our own employees and saying, please take this opportunity to have a voice in the inspection. And the tracking activity that we talked about before will kick in here. We will be notified of the 6 children and young people who are going to have that deep dive audit and analysis. That will be information will be sent to us by 5 o'clock on day 2 of inspection, that Tuesday of week 1, so fairly early on. They will provide a list of 6 children and young people, and they will be selecting those children and young people according to the criteria we spoke about before. So where are they accessing provision? Are they accessing alternative provision? Are they accessing SEN support? But also according to age ranges, they'll want to meet with a variety of age ranges. Potentially, they'll want to look at other kind of demographic information about where children are in the city, for example, or other needs that they might have. They will also provide a list of reserve children and young people, as it's been called commonly by inspectors. So these would be children and young people in a very similar position to those original 6, having the same kind of characteristics. And that's because we can only proceed with the audit and the analysis of those children and young people and their records if the family give their consent to that. So if they agree to be involved in the process of inspection. So the first thing we'll have to do is ask a practitioner who knows the children and family well to make contact with the child and their parents and carers and ask if they are happy to give agreement to be involved in the inspection. So that's something we're going to need to do very rapidly, and it's not considered appropriate for those of us working in inspection support teams to make those contacts with families. It should be somebody who knows the family well already. So, for example, a class teacher, a nursery key worker, somebody who already has that regular contact with the family and can ask them if they agree to be involved. If they don't agree to be involved, that's where potentially the reserve child or young person, their family, could be asked instead, would they be willing to be involved. The timescales here become a little pressurised in that as soon as we have that confirmation that the audit and analysis can go ahead, we have to gather a lot of information about that child or young person and records about them, and that must be provided to inspectors by the end of the week, so 5 o'clock Friday that week, day 5. So they want a lot of information there. They want a chronology of significant life events. They want details of all the services accessed, assessments that have taken place, care plans that are in place, even down to the commissioning agreements in place for any commissioned services that are supporting the child and young person and family. So a lot of information has to be gathered there, and we will be reaching out to colleagues and practitioners, asking them to provide that information very rapidly. We also have to provide some of the other information in Annex A. We have that first week to provide it, so that has to be provided by, again, 5 o'clock Friday. So a very busy week, week 1 of the process. Moving into week 2, this is where the inspection officially begins. But inspectors will be working off-site at this point, so they will not be here in Leeds with us, and any meetings that happen will be virtual. So they'll be meeting with people, as I alluded to before, those would be online meetings, or possibly, if families are not able to do that, to access spaces like MS Teams or Zoom, they may be able to have those meetings over telephone. Early doors that week, inspectors will be confirming the inspection timetable, so that will be the timetable throughout week 2, this week, and week 3, the following week, of all the meetings they want to do and the visits that they intend to carry out as well. The timetable, they will provide us with their intended timetable of the teams, services, places they want to visit, and people they want to meet with. But that timetable will be subject to change and can change quite frequently throughout the process, largely because inspectors generally will expect employees to meet with them when they ask to meet with them, but for families there will be much more accommodation given to their availability. So when are they free to meet? And obviously that will be consideration given to working families, parents who are working, and so on. This should be the point at which they will confirm which schools, settings, services they intend to visit in week 3, the following week. The tracking meetings now start to happen. So if you work with one of the children and young people who is part of the tracking sample of 6, those children and young people, this would be the week where you can expect to meet with inspectors in a small group with other practitioners supporting that child and family. And the inspectors will be meeting with the child and young person, if they're happy to do that, and their parents and carers to hear about their experiences, their outcomes from them. And inspectors will start to have meetings here with leaders, practitioners locally, and they will start to establish and follow what we call key lines of inquiry, or CLUIs. So these are kind of areas where they want to dig deeper. So in looking at the information that we've provided during week 1, in talking to families throughout this week, and talking to practitioners throughout this week, what are they finding that they want to explore in more depth? What are they finding perhaps that they might have concerns about, or be particularly interested in as good practice, or have questions about? And they'll start to follow up on that throughout the rest of their meetings during the inspection. If you are required to meet with inspectors, we, meaning colleagues like myself in the local authority, Leeds City Council, or the Integrated Care Board, if you're an NHS colleague, will be providing pre-briefings and debriefings for colleagues. So we will offer a pre-briefing before your meeting to make sure you feel comfortable, prepared, give you any information that we think might be useful to you in the meeting, and particularly as we learn from meetings that have already happened. And then after your meeting, we will offer a debriefing as well, because sometimes meetings and conversations don't quite go the way that people would have wanted them to go, and they may want to provide some additional context or information afterwards, or inspectors may have asked for further information to be provided, and it's very important that we know about that and we're able to provide it for them. So debriefings afterwards will be a useful way of making sure that happens too. So moving into week 3, this is when the inspectors will come and visit us here in Leeds, and they will have a base at Merrion House in the city centre. And from there, they will use that as their base to undertake various meetings and the visits to schools, settings and services that we've already talked about. One of the first activities in that week, our senior leaders across Leeds City Council and ICB will be delivering a presentation to inspectors talking about our local SEF, so that self-evaluation that we will have provided earlier on in week 1, describing evaluating how well we think we're doing locally, how effective our services are in improving experiences and outcomes for children, and what sort of issues do we know we need to address and improve, and how are we going to go about doing that. So that will be early on in that week on the Monday. There will be a meeting with a group of children and young people during this week. That is not defined in any way really at the moment in the inspection handbook, but we have several thriving groups of children and young people with SEND who may be willing to speak with inspectors. We have several school councils in our specialist schools, for example. We have an active SEND youth council in Leeds, so there should be lots of opportunities there for inspectors to meet with our local young people. This is where the visits will take place, of course, in week 3, and to some of those frontline services, to schools, settings, health and social care settings that are seeing families on a daily basis. And they will also be visiting those services, working behind the scenes, as it were, so to scrutinise our processes around decision making, oversights, processes like assessments, planning, other areas of practice that we are responsible for. Towards the end of the week, then on the Friday, we finally get towards the end of the process. On the Friday, that final day in week 3, final day of the inspection, inspectors will meet with our senior leaders across Leeds City Council and the ICB, and they will give their feedback, report their findings and conclusions, and they will indicate their intended judgment. So we talked earlier about how there'll be three judgments made, which are kind of as you'd expect them to be. One will be that children and young people's outcomes and experiences are good and getting better, or if they're not good, we have solid, robust plans in place to address that. There's also at the other end of the scale a judgment that we are consistently failing to support children and young people's improved outcomes and experiences, that we are not providing adequate services, and then there is a third judgment, which is somewhere in the middle, that there's inconsistency in our work here in the local area. So the inspection process in itself then ends, and at that point everybody who's been working intensively throughout the process will want to take a little break. But the work isn't completely over. The inspectors will provide a draft report, which we can then respond to if we think there are any inaccuracies or we have any concerns about that report. And then they will share a final draft. And then the local authority, Leeds City Council and ICB, we must work together to publish a revised area strategy for our SEND and inclusion services in Leeds. So what's our strategy for improvement taking into account the recommendations that inspectors have made. So how are we going to respond to their findings and the recommendations they make about improvements? And we'll have a very short period of time for doing that. So if you're a leader or practitioner in Leeds, working in education, health, social care services, what can you do to get ready? How can you prepare? First up, I would say avoid doing any work just for the sake of an Ofsted or CQC inspection. That isn't what most of us come to work for in the mornings. We're not here just to do inspections. So only do work if it will primarily benefit practice provision that you deliver. Only do that work which will help you to make improvements in your services day to day. One of the key things that we would encourage everybody to do is communicate with colleagues, partners, particularly with your staff teams, about this process so they know what to expect, because so many different stakeholders are involved and so many different services could be asked to take part in the inspection. We have a 1-minute guide. There's a link here to that, but you can also Google 1-minute guide Leeds Send inspection, and you can find that guide there, which could be a useful way to share information quickly with your teams or encourage them to watch this presentation. It's useful to think about case studies or certain pieces of evidence in your setting that you already have that might show the practice that you're most proud of in terms of your provision, the service that you work for. So best practice in how you identify needs, how you meet needs, how you engage with children and young people, support them to have a voice and influence in their own lives and in the services that you provide, and always focus there on impact. So making sure that you know what difference you're making for children and young people and you can demonstrate that impact, show that you can measure it. Think about what a visit to your school, your setting, your service, your team, what might that look like? If you're a frontline service working with children and families every day, do you have groups of children and young people? So, for example, in a school, that might be a school council, who might be willing, happy to talk to inspectors. Do you have any groups of parents and carers who use your services or access your setting who'd be happy to talk to inspectors? What are you most proud of? What would you like to share? And make sure that you've got that in mind and you're ready to share that. What areas might be not as strong, where you'd want to make sure you've got access to evidence that you are working to improve those areas. Consider your record keeping, case management, the policies that are in place in your service or setting, your staff development records and policies. Are things up to date? Are things accurate? Sometimes they are not, and that is not always easy to control. Sometimes we're dependent on complex IT systems which don't always record things in exactly the way we might find most helpful, which is okay. Inspectors don't expect perfection, but they do want to know that you know you have a problem with that, you understand it, you own it, and you've got a plan to address it if that's something you're accountable for. If you're interested in learning from other inspections in other areas that have already taken place, you can read the reports that inspectors have produced about those. There's a running list on the link here, and the Association of Directors of Children's Services, they keep this running list of SEND inspections so that you can quickly access the links to reports from Ofsted and the CQC about those inspections. And you can find more information about some of the outcomes, some of the findings of those inspections, and some really useful information that areas have shared with us in terms of their experiences of the inspection process, the sorts of questions that inspectors ask, the sort of lines of inquiry that inspectors were keen to follow. We have detailed some of that in our additional guide for colleagues who are preparing to meet with inspectors, and that's one of the resources that we will share with anybody who does get the call, who does get selected to meet with inspectors. We will provide that guide for you, along with your pre-briefing, debriefing meetings to offer support as well. Another useful activity while getting ready for inspection or thinking about the implications of inspection might be to consider the evaluation criteria that inspectors will use. So what will they be looking for when they're meeting with local practitioners, local leaders? What will they be looking for as they visit schools, settings, teams, services? I'm not going to go through all the criteria here. These are the criteria formally set out in the inspection framework. I won't go through each one here for the sake of time, but I would encourage people to take a look at these. And this can be a useful activity either as a small team or as a whole service to think about, well, how do we embody these aspects of best practice and best provision in the services that we deliver, and is there anything more we could be doing here? Are there items of evidence? Are there case studies or ways that we could demonstrate that we have these values, that we practice in this way? Also useful to remember here that the statutory framework, of course, always remains, and inspectors will always be looking to that as the foundation of practice and provision. So the Children and Families Act 2014 in terms of SEND services, and also the 2015 Code of Practice. And that brings me to the end of this presentation, which we hope you found useful. On this final slide, there are some links here that you can find further information, the 1-minute guide that I mentioned before, and also contact details. So if you need any support during the inspection process, but also at this point, if you're thinking about preparing for inspection or have any concerns, you can contact our central team who support inspections via that email address there. During an inspection, if you needed a very swift response, we would ask you to leave your phone number as well, and we will be watching that email inbox like hawks during the process to make sure that we are supporting people and offering help and advice when we are in the thick of inspection. You can also contact us outside of the inspection process on our alternative email address there. And finally, you can find out more about local services, the work that we do here in Leeds, our Leeds partnership on the Leeds Local Offer website. Again, if you have access to the written copy, printed copy of this presentation, you can click the link there, or just Google Leeds Local Offer and you will find that website in the top search results. And this is where I will leave you. I hope you found this presentation useful. If you have any feedback, that's always welcome. Critical feedback is helpful, helps us to improve. So please contact us on those email addresses above if there's anything you'd like to suggest or any ideas you have about how we can further share information about this inspection process. Thank you very much for listening. Take care. Bye-bye.